Be careful what you wish for. For nearly 8 years, it has been a battle cry for many Republicans in Congress. Repeal Obamacare. Today, it has been an exercise in futility, but there is a new president just down the street at 1600 Pennsylvania Avenue, and this one is eager to sign the bill that repeals the Affordable Health Care Act and replace it. But according to the Congressional Budget Office, up to 24 million Americans could lose their health insurance under the GOP plan by 2018. It would also cut Medicaid. The American Care Act gets rid of subsidies based on income to buy insurance and replaces them with tax credits. It also repeals the mandate requiring individuals to buy insurance and employers to offer it. Joining us right now for more is Susan Nylon, CEO of Nylon and Associates, and Dr. Michael Petit, president of the Florida Medical Association's Political Action Committee. He is also a delegate to the American Medical Association in 2015. Thank you both for joining us. Doctor, you are a Republican.
Yes.
So if you were a Republican member of Congress, would you be voting for this plan?
As I look at it, I could tell you, the first thing I want to make sure everybody understands, okay, is that Florida Medical Association is taking no stance on this particular issue. Okay, we're watching the process and we're going to continue to monitor it. That's the first thing I would say. Second thing is after analyzing this bill and seeing what it actually does, I would be part of the Freedom Caucus and saying I would not be voting for this bill.
So your position would be that the bill does not go far enough in terms of repealing Obamacare and replacing it. Specifically, do you have more of a problem that it does not fully repeal Obamacare, or it does not replace it adequately?
It's not replacing it adequately, and it's really not repealing some of the burdensome regulations that are placed on the actual practitioners that actually have to deliver care to the people. These burdensome regulations, everybody's been in a doctor's office, and the doctor has their back to the patient because they have to be on a computer the whole time, you know, documenting things that need to be documented because of the actual regulations that we have to have in effect with our reporting requirements.
Susan, I don't think anybody disagrees with that.
Sure, no, I can't argue that.
The regulatory part of it is burdensome. That's part of the problem. But for Democrats like yourself, the problem with this plan is that it takes away potentially 24 million Americans, including a lot of Floridians, from health care.
Yeah, it's a really, really scary prospect because for the first time in a lot of people's lives, they actually have access to health care that they've never had before, which means they also have access to service, which they've never been able to afford before. And to think that that could be taken away just because the Republicans want to do away with it, it's a really hard pill to swallow.
So Doctor, when you hear 24 million Americans, including, you know, many people in Florida, I would presume some of your patients, potentially losing their health care coverage, is that part of your calculation in terms of you know, what you object to? Because after all, during the campaign, President Trump said no one would be losing their coverage.
Yeah, I agree. One of the things that I, can tell you is that having an insurance card in your hand doesn't mean you have coverage. Because in the state of Florida, if you have Medicaid, there are a lot of physicians that do not take it because we do not get adequately reimbursed to take care of these patients at the costs that would be effective for the providers. The hospitals like Medicaid because they actually don't have patients now coming in with no insurance, and they get actual, coverage, developed to them. But not every physician takes care of this. In fact, the pediatricians successfully had to file a complaint against Medicaid because there were no specialists to see their patients.
But aren't those problems something that could be fixed with the current Affordable Care Act rather than just throwing the baby out with the bathwater, as they say?
Well, there's a lot of things in the current Affordable Care Act that we don't like at all. And again, like I said, if you have all those regulations in there, which thank goodness we have Tom Price in with the HHS Secretary to look at these regulations and see if we can get any relief from them.
I don't necessarily think, though, the regulations have really anything to do with whether it's the Affordable Care Act or the American Health Care Act. I mean, there's just regulations in the industry, and one conversation should have nothing to do with the other. Don't you agree?
Well, it's all in the 2,000 pages of Obamacare. So, you know, when you look at the 2,000 pages of Obamacare, and when I read this for the very first time, as a physician, my gut was churning, okay, because of the regulations that are in there and what they're trying to make us do. And when it got passed, you know, we're actually now under that burden.
But when we were talking before we went on the air, part of the issue you also have is something that is in this bill, which is that older Americans would wind up paying more for their health care coverage under this
new bill.
Your segment in the very beginning is accurate, and that's one of the reasons why I was telling you that if I were part of the Republican, you know, House party, I would not be in favor of this.
All right. When we get to our next segment, I want to ask you what you would do. Susan, put your political hat on for just a moment, because, you know, despite oppositions of the Freedom Caucus and many conservatives, if this president loses this vote now, it would be difficult. We're running out of time, but what do you think of that?
Oh, I absolutely agree. It's going to be extremely difficult, and I don't have the confidence that he actually will get this vote. There's too many people that he needs to count on that are in opposition to this.
We are just getting started with our discussion. It continues right after a check on the weather, so stay with us. Welcome back. If you're just joining us, we are discussing the GOP plan to repeal and replace Obamacare. Our guests tonight are Susan Nylon of Nylon and Associates and Dr. Michael Petit of the Florida Medical Association. Thank you again for joining us. So, Doctor, you said you're more in line with the Freedom Caucus, which is the most conservative members of the Republican caucus in Congress. So, if you're not down with this plan, what would you do?
It's really good questions as to, you know, what anybody would do for this. And as I was telling you, I mean, they had 8 years. You guys had that absolutely right. They had 8 years to come up with a replacement plan. And I think that Keith Fitzgerald probably has it right, you know, when he says that this was hastily put together. Anybody in any think tank that you're listening to and discussing this with has said that this is not a good idea.
Well, two questions. Number one, what many Democrats and supporters of the Affordable Health Care Act say about the Republican plan is if you are keeping the provisions of Obamacare where you cover pre-existing conditions and you're allowing children up to the age of 26 to stay on their parents' plan, but you are taking away the mandate to buy insurance and to offer insurance and many of the taxes, the math doesn't add up there.
Not at all.
You know, I gotta say though, I want to ask why people think there's not a mandate, because they're not calling it a mandate, but there's a penalty if you don't cover insurance. If you don't have insurance for every year. I think it's 30% surcharge that they're going to charge you if you have a lapse in coverage. So I don't understand how that is not a mandate. It's just they're just calling it a different name, but it still has the same impact.
So what do members of Congress like Vernon Buchanan do? I mean, he was there last weekend. There were thousands of people there. He was saying he's going to do his level best to prevent older Americans from not losing their health care insurance. You know, other Republican members of Congress have had similar town hall meetings up at Pinellas. Gus Bilirakis, for hours, he listened to people over multiple days, and then he just announced today he's going to vote for the president's plan. What do you do?
Well, it's deja vu all over again. You know, I mean, this is similar to what happened when they passed the Affordable Care Act. You know, where people are discussing, you know, what they don't like, and then all of a sudden, hey, you know what, I'm voting for it. So that's, you know, essentially what some people were calling walking the plank, you know, if it turns out bad.
So Susan, where does this go? Because a lot of people have said that nothing is going to pass that will actually work unless Democrats participate in the process, and the likeliness of that right now is pretty close to zero.
I don't understand how they think that if the Democrats participated in the process that it would make a difference, because I just don't think there's that opportunity. I don't think there's anything that, if you were a Democrat and they invite you just because you're a Democrat, I don't think they can actually fix it that way. You know, my concern is if it does pass just solely on party line, but it passes, it's going to take quite some time to implement. You can't just rip the Band-Aid off and start over. And the difference between now and the way it was in 2009, 2010 is, whereas before people didn't have insurance, it was the hope of getting it. Now they have it, and you're going to take that away. It's not going to be kindly received, especially by those parents who have ailing kids or anyone who needs long-term care, et cetera, et cetera. It's not going to be the same. It's going to be worse.
So Doctor, what do Republicans do if they have the concerns that you are sharing with us tonight, but knowing that if this does go through and there are people who lose their coverage or face problems because of it, it could potentially cost the Republicans their majority in Congress?
Well, you know, you got to remember, Vern did actually mention it. This is the third inning of a 9-inning, game. If it passes the House, it doesn't mean it's going to pass the Senate. I mean, Ted Cruz has said that the bill the way it is right now, if it passes the House, it will not get through the Senate.
Same thing with Rand Paul.
So therefore, before it has to get up to the president's desk, it's got to get through both houses.
Right. But that brings us back to the point that I was trying to make a little while ago. One of the knocks against the Affordable Care Act, or Obamacare, is it passed on a strictly party line vote. So when there were problems that became obvious, there was no reason for Republicans to assist in fixing it. If this or a Republican bill passes on a strictly Republican party line vote, there's not going to be any reason for Democrats to try to come together and try to fix this and make it work.
I would happen to agree with you. That is correct, because why would you?
So how does this great problem, which the president recently said is pretty complicated, get fixed?
We were discussing, part of the medical industrial, complex earlier, and there's a lot of people that have their hands in the cookie jar, when it comes to being paid.
Right, and I should tell you what we were talking about. My son recently had to go to the hospital. He got sick, had to stay over a night, just IV fluids, some tests, and so forth. I got a bill for $250, but the bill was $14,000.
Yep.
And I appreciate the IVs and all the doctors and nurses, but what made up that $14,000, and isn't that inherently part of the problem?
Well, transparency is not there. We're not really competing in an open market. And when they discuss various different things and competing in an open market, they discuss it, free and willingly. But yet, when they implement various different laws, it's not what's actually there.
I was looking at some of the details of this proposal, and one of the things that I don't think anybody who's watching this tonight could be happy about is that, not only are older people going to have less coverage, but there are these things about tax breaks for healthcare executives making over $500,000 a year. The bill would cut some taxes for the elderly, a 3.8% tax on investment income, and not only that, it eliminates federal funding for Planned Parenthood. So there's a lot of things mixed in there, which is not what the people who are watching this tonight were hoping for when they cheered for the repeal of Obamacare.
I would happen to agree. And we talked about that when the president actually campaigned. He said repeal and replace.
I want to ask, though, because the difference between the two plans is clear. The new plan, the Republican plan, is giving you a tax credit after the fact. You still have to put the money up every month to pay those bills, which without a subsidy for a lot of people, in fact, I think it's 65% of the people that are on it, can't afford it. So they won't be able to afford to purchase the health care. And if you're not making that much money, nobody cares about a tax credit because they're not making enough to get a tax out,
All right,
pay taxes.
Let's take a quick break, and when we return, we'll have final thoughts from our guests, so stay with us. Welcome back. How would the repeal of Obamacare and signing of the American Care Act affect the coverage of Floridians? Our guests join us right now for final thoughts. So, Doctor, you are for the repeal of Obamacare. You are not for the current Republican bill. So if you repealed Obamacare, what comes next?
Well, it would have to follow a process. I think that the process that was followed back in 2009, 2010 was purely on party lines. When we looked at healthcare reform in the state of Florida, when we were looking at that, we wanted every party, in a room to discuss the issue and get thoughts from everybody, and then come up with various different points to be able to make in order to come out with something that would be acceptable to everybody in the state of Florida, so that the doctors can actually practice, that the patients can actually get care, and that they have coverage to get to where they need to be.
Boy, after all this time, it seems like we're a light years away from that happening. Susan, what do Democrats want right now? Because the Affordable Health Care Act today is law, but it is, there are so many problems with it. That's why there are so many people who want to repeal it.
Well, I wouldn't say so many people want to repeal it, because there's 24 million people who don't want to repeal it. I think if the Republicans wanted to be the hero, they would take what we have and fix it.
That's not going to happen.
And improve it. I get it. But I don't think the Democrats in the House or the Senate are going to make a difference either. I think it's really going to happen on the streets. I think it's the individual person who has to go to their representative or their senator and say, this is not acceptable.
But let me push back on that, because as we said, we had all these town halls. I'm talking about Gus Bilirakis in Pinellas.
Yeah.
He said, I'm going to listen to exactly what you're saying.
But he's still going to vote for it.
Yes.
Well, you know what? He's going to have to deal with the fallout from doing that. I don't think that they could actually implement what they're going to do. I don't think they'll be able to actually take away what they say they're going to.
And Doctor, if the president is saying to his fellow Republicans, if you're not with me, you're going to lose your seat in Congress, where do you think that's going to play out?
It's a good question. I mean, if this is truly what you're going to be seeing, these 24 million people out of, insurances, you're going to see a lot of angry people out there. And then, with a lot of angry people out there, it puts a voice to, and a fire under people to want to go vote. So it's very possible that they, will lose their seat in Congress if it does pass.
Okay. Thank you to our guests for being here tonight. Susan Nylon is CEO of Nylon and Associates, and Dr. Michael Petit is the president of the Florida Medical Association's Political Action Committee.